1,053,370 injuries were estimated to have occurred in the ACC athletics in 2013-2014. That equates to every athlete enduring one injury in at least one game of the season. What if someone told you that you could reduce your risk of knee injuries by 70%? This could be achieved by performing small warm-up exercises before training. These exercises have the potential to revolutionize the way in which athletes, specifically female athletes, train. The cause of this can be categorized as hormonal, anatomical, and neuromuscular differences between genders. Dr. Gettler describes this.
Why are females more likely to have an ACL injury? There are a lot of studies looking at this, and there are multiple potential factors. We have looked at anatomical reasons. Females tend to have a wider pelvis and more valgus of their knees. They're basically more knock-kneed. This can put the ACL at risk. Females can tend to have a smaller ACL in general, and it can also live in a smaller area in the knee, which can put them at risk of injury. And when we look at our males versus our female athletes, males tend to have better core control and better control of their proximal muscles. So when they jump or they land with their knees bent and their body in a very good position. When our females tend to do the same type of thing, they tend to land either very upright or with their knees in a valgus position, which puts them more at risk of injuring their ACL.
Men have more muscle tissue in their quadriceps and hamstrings. These two large muscles, especially the hamstring, are primarily responsible for the stability of the ACL and ligaments around the knee. Women are not only have less muscle tissue in their bodies overall, but have significantly less muscle tissue in their hamstring compared to men. This causes women to be especially prone to knee injuries because they lack support from behind the knee. A new school of thought entitled Exercise-Based Knee Injury Prevention focuses on exercises specifically tailored to strengthen muscle groups around the knee. These exercise-based knee injury prevention programs focus on strengthening female athletes' knees during preseason. This research has proven that performing these preventative exercises 2 to 3 times per week during preseason and 1 to 2 times per week during competitive season will significantly decrease the number of knee injuries endured by women. The most damaging movement to knee ligaments is explosive power movement on one leg. Rather than changing the movement that athletes need to perform, they can focus on changing the intention of the movement to save their knees from excess strain. For instance, a dancer could focus on using his or her quadricep muscle rather than their hamstring during the preparation for a pirouette. Because the quadricep muscle is larger and stronger than the hamstring, it will absorb more of the pressure placed on the knee and in turn save the dancer's knee from injury. Some knee injury prevention exercises include a combination of plyometric training, strength and power exercises, balance and dynamic stabilization training, core strengthening, and sport-specific drills.
So there have been very good studies that have shown with neuromuscular training programs, basically programs that can be 15 to 20 minutes that these athletes can do with their team as a warm-up, that work on core, hip flexor, abductor, quad, and hamstring strengthening, that we can actually train these young females to land and pivot and move better on the playing field. Some of these studies have shown a 40% decrease in ACL injuries.
It is imperative that not only female athletes, but all athletic trainers, coaches, understand and act upon this research. Implementing daily exercises to strengthen the ligaments surrounding the knee and focusing on using larger muscle groups during explosive movement can revolutionize the field of athletics for women. For further viewing,